Hello everyone, I'm Pranita, working at International Center for Research on Women as Director Research and Program. I feel privileged to be part of the WomenLift Health first cohort of India. I'm here sharing about my project, centering voices and choices of women and girls in quality of family planning services. It's not a project, it's a vision, a journey on a rugged path. Will continue. Despite growing recognition, family planning in India continues to operate as a tool to control population and uses women merely as an instrument. With overt emphasis on numbers, women are pushed out with little consideration for their rights to choose, make informed decision, right to receive quality, respectful, stigma-free services. They hardly get space to voice their opinion, their concerns. Time and again, quality of family planning services are compromised and women pay heavy price with their dignity, health, even with their life. When only half of the providers use sterile gloves in spite of availability before inserting IUCD during postpartum, we know it's not a supply issue. Probably not even a clinical training issue, but definitely a gender issue, definitely compromise with the quality of services. It reflects of how health systems see women, particularly from marginalized communities, and prepare health providers to engage with them. It's definitely about women's experience, their voices and choices not being recognized and considered in provisioning of quality family planning services. This is what my project is about. How to center stage voices and choices of women and girls in family planning, not only in provisioning but also in assessment. I have planned to take on this through evidence-informed collaborative efforts within public health system in Bihar. This project has three core components shaped by my own journey through the fellowship. First component is to facilitate use of evidence to discover and plan, discover self and environment, and develop a grounded implementation plan. Idea is to use evidence to facilitate discussion and help service providers identify gaps in quality of family planning services, examine their own perception and behavior, and also highlight their strengths. We have found that positioning evidence as tool to facilitate discussion and enable them to visualize implication and consequences garner higher acceptance and engagement. For example, understanding the effect of target approach on women and service provider is likely to encourage district and state officials to think about strategies to enhance efficiency and performance without getting trapped with targets. This will also give health providers opportunities to recognize and share their own challenges and vulnerabilities. The second component is mentoring service providers to build their gender perspective and provide tools to bring women's experiences and voices in monitoring quality of services, while strengthening systems accountability towards women's choices and voices. The third component is identifying potential women leaders at facility, district, and state levels to demand and advocate for center staging choices and voices of women and girls. These women leaders could anchor and sustain the process. This has to continue, and they are going to be the key player in this whole process. Collaboration is necessary, but never easy. My leadership project is situated within ICRW's Quality of Care initiative in partnership with other institutions, both government and non-government organizations. While this partnership is adding a lot of value or will be adding a lot of value, it has definitely slowed down the whole pace of implementation. So far, I have been able to work towards developing rights and empowerment framework with choices as the core gender construct within service delivery setting. This framework includes specific themes such as decision making, like when and how decisions of using a particular method is being made, how informed the process was, who participated in, and how much space women had to express their opinion and assert their choice. It also includes consent process, clinical care, along with systemic issues like targets, incentives, role rationalization. I have been working with other colleagues to analyze quantitative and qualitative data that we have gathered from different stakeholders and currently synthesizing evidence and working out partnerships. Quite challenging. In coming months, we'll be focusing on disseminating, mentoring service providers, women leaders, and I assure you that this is not going to end with the this leadership journey. While this project is situated within Bihar, I will be leveraging other ongoing efforts in other states to disseminate and push forward the agenda of centering women and girls' voices in health system. At the end, I would like to thank WomenLift Health for all the support and strength, for creating spaces to connect, reflect, and examine ourselves and the process and systems around us, to give us courage to share our feelings, challenges, contradictions, even claim our position and express our strengths. Thank you all.